Welcome back to the deep dive. So, you sent over a whole batch of sources, notes, research, all focused on canine influenza.
Yeah, dog flu. It's definitely a topic worth digging into.
And that's exactly what we're going to do. Our mission is to unpack everything you provided, pull out the key knowledge nuggets about this illness that affects our dogs.
It's a big one for dog owners.
It really is. It's that contagious respiratory disease. Sometimes it gets quite severe. Definitely something you need to know about if you have a dog. Okay, let's dive in.
Let's do it.
So maybe the most basic place to start. What exactly is canine influenza based on these sources?
Okay, so fundamentally, it's a respiratory infection in dogs.
Okay.
It's caused by specific type A influenza viruses. Think of them like cousins to human flu viruses, but these ones are adapted to dogs.
Right, like the flu we get, but for dogs. And do these dog versions change, evolve over time?
They absolutely do. That's a key point in the material. These viruses evolve, and that's why we see outbreaks popping up globally. The courses mentioned North America and Asia as particular hotspots.
Okay, so highly contagious, constantly shifting, sounds familiar. How serious does it typically get?
Well, the sources say it's actually rarely fatal overall, which is good news. But, and this is important, it can cause pretty severe illness.
Especially in certain dogs.
Exactly. Puppies, older dogs, dogs that already have health problems, maybe a weakened immune system, they're the ones most at risk for getting really sick from it.
Got it. And the sources zeroed in on a couple of specific strains, didn't they?
Yes, two main ones you really hear about.
Yeah.
First is H3N8. That one was identified back in 2004 down in Florida.
Okay.
And the thinking is it actually jumped from horses' equine flu and adapted to infect dogs.
Wow, from horses. That's wild how these things cross species. What was the other strain?
The other big one is H3N2. This one showed up later in the U.S. around 2015, but it originated over in Asia.
And where did that one come from?
The sources suggest that one likely came from birds, avian influenza, before it adapted to dogs.
So different starting points, horses, birds, but both now circulating in dogs and causing trouble.
That's right. Both are contagious. Both have spread.
And a really crucial point from the material. Unlike our flu, this isn't seasonal, is it?
No, that's a major difference. The sources are clear. Canine influenza can hit any time of year. No flu season for dogs.
Okay, so we've got a contagious, evolving, year-round virus that can be rough, especially for vulnerable dogs. How does it actually pass between them, and where are they most likely to run into it?
Well, the main way it spreads is pretty much like human flu through respiratory secretions. Coughing, sneezing, even barking sends out these little virus particles.
So direct contact, dog to dog.
Yes, but also, and this is really key from the sources, indirect contact. The virus can actually survive for a while on surfaces.
Like what kind of surfaces?
Things like kennel walls, food bowls, water bowls, leashes, bedding, even people's hands and clothes.
Oh, wow. So you could actually carry it between dogs without realizing it.
Absolutely. You pet an infected dog, then pet yours, or handle a contaminated leash. It's easy to see how it spreads indirectly.
Which makes places where lots of dogs congregate really high-risk zones.
Definitely. The sources specifically call out places like boarding facilities, groomers, dog parks, shelters, training classes, anywhere dogs are sharing space or items.
Makes sense. And we touched on this, but remind us who's most likely to get severely ill if they catch it.
Right. So the risk factors for severe disease mentioned in the material include age, so very young puppies and senior dogs.
Okay.
Also, brachycephalic breeds, those short-nosed dogs like pugs and bulldogs, seem to have more trouble.
Ah, okay.
And then dogs with compromised immune systems or those who already have some kind of respiratory issue, they're definitely at higher risk for complications.
Okay, let's shift to symptoms. If your dog gets exposed, what are you actually going to see? Because the sources said it can look like other stuff, like kennel cough.
Yeah, that's a really important point. The symptoms overlap quite a bit with other respiratory things, which can make it kind of tricky to identify just by looking. And the severity can range hugely, from barely noticeable to really quite sick.
So what are the classic signs owners should be watching for?
The most common thing is usually a cough, often persistent. It might sound dry and hacking, or sometimes more wet, productive. Sneezing is common too, along with nasal discharge.
What kind of discharge?
It might start clear, but if a secondary bacterial thing sets in, it can get thick, yellowish, maybe greenish. Fever's typical as well, could be mild, like 102.5 to 104 Fahrenheit, but it can shoot up higher in bad cases.
And I imagine they just feel lousy.
Oh yeah, lethargy's a big one. They'll be tired, just not themselves, maybe not interested in playing or walks. Loss of appetite often goes with it.
Anything else?
Some dogs get eye discharge. And a really key warning sign for more serious trouble is labored or rapid breathing. That suggests it might be progressing to pneumonia.
Okay, now here's something from the material that really stood out. The dogs that don't show any signs.
Ah, yes. The asymptomatic carriers. This is super important for understanding spread. The sources estimate about 80% of infected dogs show signs.
Which leaves 20%.
Right. About 1 in 5 infected dogs might show no symptoms at all. They seem perfectly fine, but they're still shedding the virus and can infect others.
Wow. 20% are silent spreaders. That must make controlling outbreaks incredibly difficult.
It really does.
And what about those severe cases you mentioned? If it does get bad, what does that look like?
In the really severe cases, you might see a high persistent fever, definitely signs of pneumonia like that. Difficulty breathing, dehydration can set in, and those secondary bacterial infections become a major concern.
And unfortunately, it can be fatal sometimes.
Yes. While the overall mortality rate mentioned in the sources is less than 10%, complications, especially pneumonia, can sadly lead to death, particularly in those higher risk dogs we talked about, the very young, the old, the immunocompromised.
Okay. So your dog is coughing, seems off, maybe they were recently boarded. The vet suspects dog flu. How do they actually confirm it, given the symptom overlap?
Yeah, that overlap is why lab testing is often needed, according to your sources. It just looks too much like kennel cough complex, adenovirus, parainfluenza. You need tests for a definitive diagnosis.
So what does that process involve? What does the vet do?
It usually starts with taking a really good history, asking you about recent exposures, travel, boarding, grooming, dog parks, and then a physical exam, checking for fever, listening to the lungs, looking at any discharge.
And then the actual lab tests.
The main one highlighted in the material is PCR. That's polymerase chain reaction. It's usually done with a swab from the nose or the back of the throat.
Yeah.
It's very sensitive for detecting the virus's RNA, its genetic material.
PCR. Got it. Is that the only way?
Another option mentioned is serology. That involves blood tests, looking for antibodies that the dog's immune system produces against the virus.
How does that work?
Often they'll take paired samples, one early in the illness and another maybe 2 or 3 weeks later. If they see a big jump in antibody levels, that confirms a recent infection. Virus isolation is also possible, but it's apparently less common.
Okay. And what if they're worried about pneumonia specifically?
Then the sources say chest x-rays or radiographs are usually the next step to actually see what's going on in the lungs. They might also run blood work, a CBC, chemistry panel, to check overall health and look for signs of secondary infection.
And timing matters for testing, right? Better to test early.
Yes, the sources suggest testing is most useful in the first few days of symptoms, say the first 3 or 4 days. That's when the virus is typically shedding the most.
Okay, so we know what it is, how it spreads, the symptoms, how it's diagnosed. Let's talk treatment. Is there, like, a Tamiflu for dogs, a specific drug to knock out the virus?
That's a really critical point from the sources. No, there isn't a specific antiviral drug approved just for canine influenza. Treatment is almost entirely supportive care.
Supportive care. What does that mean in practical terms?
It means managing the symptoms, keeping the dog comfortable, hydrated, nourished, and trying to prevent complications like secondary bacterial infections, basically giving their own immune system the best chance to fight off the virus.
So what kind of things does that involve?
Lots of rest is key, letting their body focus on healing, making sure they stay hydrated. Sometimes vets give fluids under the skin or even IV fluids if they're really dehydrated. Good nutrition is important too, maybe tempting them with tasty food or using appetite stimulants if they don't want to eat.
Are medications ever used then?
Yes, but not for the virus itself, according to your material. They're used for the symptoms or secondary issues.
Like what?
Like cough suppressants if the cough is really hacking and unproductive, keeping everyone up all night. NSAIDs, nonsteroidal anti-inflammatories, can help bring down fever and reduce inflammation.
And antibiotics.
Only if there's evidence of a secondary bacterial infection, like pneumonia. Antibiotics do nothing against the virus itself, so they're only used if bacteria are complicating things.
Right, and for those severe cases, maybe with pneumonia.
Those dogs often need to be hospitalized, the sources say. They might need oxygen therapy if they're struggling to breathe, plus more intensive monitoring, IV fluids, maybe IV antibiotics if needed. It's much more involved.
Okay. Given how easily this spreads and the lack of a direct cure, prevention seems like it must be hugely important.
Absolutely paramount. The sources really stress prevention, especially for dogs in those high-risk situations, boarding, daycare, parks.
And there are vaccines, right? Like flu shots for people.
Yes, thankfully. The material confirms vaccines are available for both H3N8 and H3N2. Some are bivalent, meaning they cover both strains in one shot.
Does the vaccine guarantee they won't get sick?
Not always guarantee they won't get infected, but this is the key takeaway from the sources. The vaccine is very effective at reducing the severity of the illness and how long it lasts. So if a vaccinated dog does get exposed and infected, they're likely to have a much milder case. It makes a big difference.
So who should get vaccinated? Is it for all dogs?
It's generally recommended for dogs considered high risk. So yeah, dogs that are boarded frequently, go to groomers, doggy daycare, dog parks, or travel for shows or competitions where they meet lots of other dogs.
And how does the vaccination schedule work?
Typically, it's an initial series of 2 shots, usually given about 2 to 4 weeks apart. And then, like many vaccines, an annual booster is needed to maintain protection.
Okay, so vaccination is one big piece, mainly reducing severity. What else is crucial for prevention?
Hygiene and sanitation are huge. Regular, thorough cleaning and disinfection of surfaces. Dogs touch floors, crates, bowls, bedding. Good hand washing is critical, especially if you're handling multiple dogs.
Like in a shelter or kennel?
Exactly. Even changing clothes between handling different groups of dogs can help stop the spread on fomites, those contaminated objects.
And if a dog actually does get diagnosed or is strongly suspected?
Isolation. That's non-negotiable according to the sources. Infected dogs need to be kept completely separate from other dogs for at least 21 days to prevent further spread. Facilities facing an outbreak need really strict quarantine and disinfection protocols.
Okay, let's pull it all together. For the average dog who gets canine influenza, what's the outlook? What's the prognosis?
Generally, for most healthy adult dogs that get good supportive care, the prognosis mentioned in the sources is good. Most will recover fully within about 2 to 3 weeks.
But complications can happen, as we discussed.
Yes, complications are more likely, and recovery can take longer for the very young, the very old, those with underlying health issues, and especially for dogs that develop pneumonia. Those cases might need that hospitalization and more intensive care.
You know, what's really striking from all this material is how much managing this really depends on, well, everyone being aware and taking action. Owners, vets, facility managers.
Exactly. The sources really emphasize that, recognizing it's serious and contagious, but also knowing that good supportive care works for most, and that early diagnosis, isolation, and prevention, vaccination, sanitation are absolutely key to controlling it.
And it sounds like things are maybe getting better. The sources hinted that increased vaccination and awareness are helping.
Yeah, it seems the veterinary community feels better equipped to manage outbreaks now, partly because more people are aware and taking those preventative steps, like vaccinating high-risk dogs. It helps protect not just the individual dog, but the whole community.
Right. Well, this has been a really comprehensive deep dive into canine influenza, based entirely on the sources you brought to the table. We've hit the causes, spread, symptoms, diagnosis, treatment, and, crucially, prevention.
Yeah, it covers a lot of ground. It really highlights that while it's a real threat, knowledge and proactive steps can make a huge difference.
So what's the big takeaway here? It's serious, it's definitely out there, it's contagious, but it's manageable if you know what to look for and what to do.
And talk to your vet, especially about vaccination, if your dog fits that high-risk profile.
Absolutely. Being informed is key.
It's about protecting your own dog, but also being mindful of the health of other dogs they might interact with.
Okay, so based on everything we unpacked from these sources, the virus evolving, this asymptomatic carrier spreading it silently, here's something final for you, the listener, to think about. How does that ongoing potential for hidden spread really change how you approach protecting your own dog, and maybe how you think about the risks involved in group settings like dog parks or daycare? Something to chew on.